Hi everyone, I am Dr. Jody Athena and welcome to my health video series on Polycystic Ovary Syndrome, or PCOS for short. In this series, I will delve into the various aspects of PCOS, including its causes, symptoms, and the impact it can have on overall health. Get ready to take control of your health and embark on this empowering journey towards managing PCOS. Stay tuned for the first episode and remember, knowledge is the first step to wellness.
Polycystic ovarian syndrome is a health condition that is increasingly being diagnosed in women. It's a condition that's characterized by an imbalance between the hormones estrogen and testosterone that causes a set of signs and symptoms that I'll discuss later in this video, and which, when the doctor requests imaging, is seen as several cysts on the ovaries. Okay, so you may be thinking, who is at risk of getting this disease? And should I even be watching this video? Given how common it is, there is likely to be a woman in your life who is affected. In fact, women worldwide are affected at a ratio of 1 in 10. There are some things that we can change and others we can't change that increase our risk of developing polycystic ovarian syndrome. Let's talk about things that increase your risk of developing PCOS. Things that you have no control over include your ethnicity, whether or not you have a family history of PCOS, such as a mother or sister with the disease, whether or not you had your first period at an early age, as well as if you have certain chronic illnesses, such as diabetes mellitus. However, there are things that you can control, such as your weight. Patients who are obese are at increased risk of developing PCOS. Also, there are certain medications that increase your risk of developing PCOS. If you'd like to know more about this, then please seek guidance from your healthcare physician. Now, let's talk about what happens in women with PCOS. Let's talk about what happens in a normal menstrual cycle. In a normal menstrual cycle, as we can see at the top right-hand corner, we can see the egg going through various stages of development until fully mature. Once fully mature, the brain sends a signal to the ovary for the release of this egg. The release of the egg from the ovary is called ovulation, and with ovulation, one of two things can occur. Either the woman can become pregnant if the egg is fertilized, or two, she has her normal menstrual period. For this all to occur, there needs to be a smooth, coordinated interaction between the brain, the ovary, and various hormones. In PCOS, there can be problems at any of these various stages, and so the woman fails to ovulate and has symptoms of such. Let's talk about the symptoms of PCOS. I like to think of the symptoms of PCOS in two broad headings. Those due to an inability to release an egg each month, as well as those symptoms that are due to an elevated level of the hormone testosterone. Let's talk about the first. Due to an inability to release an egg each month, a woman may find that she has irregular periods. In addition to the irregular periods, she may find that when she does have her period, the periods are extremely heavy. Also, she may find that she has difficulty getting pregnant. Symptoms due to an elevated level of the hormone testosterone include male pattern hair, as depicted in this picture, as well as the presence of excess acne. Now that we've talked about some of the symptoms associated with PCOS, let's talk about some of the complications. Patients with polycystic ovarian syndrome who are overweight or obese are at increased risk of diabetes mellitus, hypertension, heart disease, as well as trouble sleeping. All patients with polycystic ovarian syndrome are at increased risk due to the hormonal imbalances involved of disorders such as cancer of the womb, endometrial cancer. Now that we know about what PCOS is, its symptoms are, as well as some of the complications of the disease, let's talk about how we can tackle polycystic ovarian syndrome. What are the treatment strategies? Let's talk about the treatment for polycystic ovarian syndrome. Unfortunately, there's no miracle cure for PCOS. However, there are many different medications that can be used to help. But before we even get to medications, if overweight or obese, the mainstay of management is actually diet and exercise. With diet and exercise, many of your symptoms can actually go away. And if diet and exercise are insufficient, then medications can be added to therapy. We're now at the end of today's video. If you've liked it or found it informative, please remember to like, subscribe, and to share the video. Also, if there's any ideas that you'd like for upcoming videos, please let me know in the comment section. Thank you and have a great day.